Thank you very much. Good morning, everyone. I have the pleasure of introducing Morgan, our speaker for today. So a bit about Morgan. Morgan Yacoe, she comes from Richmond, Virginia, and was raised in Montclair, New Jersey. And she received her Bachelor's of Fine Arts from Virginia Commonwealth University in Sculpture in 2011, and her Master's of Fine Arts, also in Sculpture, from the University of Florida in 2020. And she's now a working sculptor, working out at the Waldo Road Studios, assistant adjunct professor at both the University of Florida and Santa Fe College in both art departments. And she is also a research coordinator at the Center for Arts and Medicine at the University of Florida. Her research studies include the integration of arts in medicine and education. Morgan hopes to continue her path as an artist, educator, and researcher. So thank you so much for being here, and we're looking forward to hear your talk.
Thank you both.
Turn this down.
All right. Am I mic'd up?
Yep.
Can you all hear me?
Maybe speak a little bit.
Hello?
Yep.
Okay, cool, great. All right, let me get my presentation up here. Okay, all right. Is it, I'm wondering if the screen is sharing. Let me Zoom. Okay, share screen. There we go. Okay. Slideshow. Wait from the beginning. All right. Okay. So everybody on Zoom can see the slideshow, and everybody here can see it. Perfect. Okay. Thank you all so much for being here today. My name is Morgan, and I am a researcher, educator, and artist. My research is primarily focused on integrating the arts, specifically sculpture, as I do have degrees in sculpture, in medical education and just education in general. So in this talk, I'm going to go over a couple of, well, probably about like 5 or 6 projects that I've worked on over the years. And I'm going to begin with actually my very first project that I ever worked on that was collaborative with the medical community. And it is a project that really started my career. Okay, so my first project was creating a medical sculpture to aid with the separation of conjoined twins. Now, this happened while I was a senior at VCU, Virginia Commonwealth University in Richmond, Virginia. And this is how it began. I was a senior and I was thinking about going to a medical school, but I was also studying sculpture. So I decided to start to shadow doctors that I thought had an inherent intersection between sculpture and medicine. And I thought that reconstructive plastic surgery really had that intersection instilled within its practice. So I began to shadow this really exciting pediatric plastic surgeon named Jennifer Rhodes. And before I know it, I'm shadowing her while she's operating, and she's asking me, what are you studying? What is your major? And I said, oh, sculpture. And she looked at me and she said, you know, this is sculpture. She was like, what I'm doing is sculpture. And then she said, I think I have a project that you could help with. She said, I'm going to be separating a set of conjoined twins in the fall. And I read this article about this group of physicians who took a casting of a set of a conjoined twins before the surgery, and then made a model that could be used to help with surgical planning. She said, "So can you do this for me?" I said, "Of course." Even though I had to develop those skills along the way, I said, "Of course, yes, of course, of course." So what I ended up doing is creating a multi-component medical model that helped with the abdominal wall reconstruction after the separation of these twins who are Omphalopoulos conjoined twins, which poses a challenge for the reconstructive surgeon, as the separation often results in a large defects involving both the skin and the abdominal wall. So she needed something that she could practice on. So you can see here, the project was to create a multi-component medical model devised to simulate the various soft tissue elements and enhance pre-surgical planning capabilities for the plastic surgery component of the procedure. So this model didn't involve any like interior organs. She was just using this for the tissue planning. So this kind of gives you an idea of the final product. A life-size model was cast of the twins, including the lower thorax and the abdomen. The model consisted of a foam core simulating the density of the soft tissue with a silicone rubber skin. So that pink stuff is rubber, is a silicone rubber. The tissue expanders, so those balloon-like shapes, those were representing tissue expanders at different stages of their enlargement that were then sculpted onto the model to determine the amount of additional skin that was required. So once they were separated, she was essentially creating skin that could go over the abdominal wall defect. Does that make sense? Yeah, okay, cool. So the reconstructive design elaborated on the model was used during a 20-hour operation that resulted in the twins' successful surgery. The creation of a customized medical model enhanced the pre-surgical planning. So that was my very first project within this field, and it really kind of gave me a lot of excitement about it. I was lucky enough to do a second set, and in this way, you can kind of see how I was able to capture more nuances of the form because I had advanced my casting skills by using a casting method that was able to pick up more detail. So this is a model of a different type of twins, but very similar, called thorophagus conjoined twins. And this is kind of a neat picture because this was taken right after I took the casting of the twins. Excuse me. And you can kind of see do you guys see how what I'm holding is the initial mold? You can kind of see the imprint of their torsos. Is that making sense? It's oh, thank you. This is the initial mold. So this is the negative of their bodies. So it's like taking a mold of anything. Okay, and we published this in the Journal of Craniofacial Surgery. It was on CBS News. It was on NPR, and we presented it at the American Society of Surgeons annual meeting. Okay, so from that, it kind of started a whole slew of projects after that. So this is one of probably my most favorite projects. Teaching breast aesthetics. Oh, sorry, I can't really see. Using. Yes, please. Yes, please.
Click on those three dots. And then come down to hide floating.
Okay, thank you. Teaching breast aesthetics using a sculpture-based simulation workshop. So with over 106,000 patients undergoing breast reconstruction each year, it is critical that trainees, surgery residents, develop an eye for breast aesthetics. To enhance learning, I developed a simulation-based approach to teaching breast aesthetics, including form, symmetry, perspective, and observational skills. So basically for this, what I did was pretty simple. We found this really awesome woman who had undergone a unilateral mastectomy, and she had agreed to let me cast her torso. So from that casting, I created 5 resin castings of that sculpture, and then we held a workshop. There we go. Okay. The creation of a workshop using resin casts, so resin's like plastic, obviously, of a female torso after unilateral mastectomy. Subjects, which were the plastic surgery trainees, they used clay and sculpting tools. Each student was tasked with recreating the absent breast, requiring careful observation, critical examination, and translating the conceptual into a multi-dimensional creation. So you can see how here in this picture that it was really collaborative, that the students were really learning what the shape of the shape of the torso is versus their preconceived notions. The model even allowed the students, especially the male trainees, an opportunity to look at the model from the patient's vantage point, as shown in this image. It's pretty powerful. This allows the residents the time to reflect on the patient's expectation and the cultural pressures that they may live with. The project was also done in collaboration with the BCU Division of Plastic and Reconstructive Surgery. So these exciting kind of action-packed images give you an idea of the feel of the workshop. Very creative, very hands-on, and the attending physician, Dr. Jennifer Rhodes, you can kind of see her here in the background. She was there kind of like assisting, and it was really an awesome time for the residents to have these conversations outside of the high-pressured operating room. Okay, so the next model that I made, which was kind of a progression of this, was to make a model where the plastic surgery residents could actually practice the actual technical surgery procedures for this operation. So what I created was an advanced microsurgical training model. This medical sculpture allows the residents to practice and perfect a specific microsurgical technique that is critical to the success of DIEP flap breast reconstruction. Breast reconstruction where a woman can use her own tissue instead of a breast implant. It's a kind of a newer procedure, so training is really critical. The model is completely reusable and unique, and could only and is made of a silicone exterior and a plastic support structure. And it's made of silicone because silicone is a material that can most realistically simulate tissue, as you saw with the conjoined twins model. Thank you. The form is based off of an average size woman, not a idealized female form that is so often used for commercially available surgical training models. So a question that I get about this model often is this reusable? Because it's such like a developed model. It'd be kind of a shame if you could only use this once. But it is completely reusable, and the only thing that needs to be replaced is a small blood vessel, which is easy. Okay, so just to give you all a little bit of background on this procedure, DIEP flap surgery is breast reconstruction procedure that uses a flap of tissue from the stomach that is then brought into the chest cavity for a reconstruction. So what's really critical for the surgery is for the doctors to really master anastomosis, which is the suturing of blood vessels. This model allows the residents the opportunity to practice attaching the donor tissue blood vessel to the chest cavity. So this is the final sculpture from a different perspectives. And you can see here that they were actually able to use it. They're using microscopes because it is microsurgery. They need the microscope to be able to see exactly what they're doing. As I said before, the model was used to practice anastomosis, and they can test the quality of their sutures. Another pretty cool component of this is that it was a collaboration between myself and a engineer, Peter Pico. My role was to create the actual torso, But what Peter did is he created this really advanced pump that lived inside of the model that was actually giving fluid to the vessels, so they could actually practice, so they actually see the quality of other sutures, so they could see if like anything was leaking. It was really, really cool. And this is some of the process shots. So you can see here, this is me and my assistant in my studio, actually at UF when I was a student there. This was done when I was a graduate student. But it was interesting because I was a graduate student at UF, but I was doing this as a independent sculptor at a VCU. We had gotten a pretty substantial grant. It was called the commercialization grant at VCU to be able to make this happen. It was presented at the Alliance for Women in Media, Arts, and Sciences at UC Santa Barbara. It was on the Channel 12 News. A couple of exciting articles came out in the VCU News, and we also presented this project and also the breast aesthetics project at the American Society of Plastic Surgeons 2018 International Conference in Chicago, which was really exciting. And as I said before, it was awarded the VCU Quest grant, which is how we were able to actually make this happen. Okay, so another exciting project is the creation of curriculum and art classes for medical students and their residents. So drawing and sculpting workshop. So this is the whole class is called the Art of Observation. And it's drawing and sculpture workshops carefully designed to teach medical professionals at any level of training the creative, observational, and empathy skills required to treat the unique needs of individual patients. The workshops. Burnout and cynicism have unfortunately become a problem in graduate medical education. Students have no hands-on way to really apply their knowledge of anatomy and their knowledge of observational skills, which are really critical. These artistic workshops help to solve these problems. And you can see here they're sculpting a bust. And over here, they were drawing the figure. And we actually had like a nude figure there in this medical education classroom. So it was really like trying to get it as like realistic as possible to a traditional art class. Same here, we had a live model in the center of the class that the students were sculpting from. And this was actually the very first class I taught. And it doesn't look like much, but what they're actually doing here is they're setting up the armatures to create full figure sculptures, which are really important. It's kind of a cool project. This promotes creativity at a level that is sensory as well as analytical. In addition, students are encouraged to share with their fellow classmates their progress in developing artistic skills. This cultivates a community spirit, something that is often overlooked within medical education. And this was actually here at the University of Florida. And it was not a sculpting workshop, but it was a drawing class. And this is Dr. Bruce Mast. I'm not sure if he's still there, but at the time he was the director of the surgery department. And in this workshop, what they had requested was really interesting. They wanted to learn how to draw a face and also learn how to draw a hand. And what was the reason why they wanted that is so that they could quickly like make a sketch of a face to help communicate surgical procedures to patients as well as hands. Because those are two pretty common areas of the body where they operate on. This was these workshops were highlighted in a report that was put out by the National Academy of Sciences. Me and my collaborator, Dr. Jennifer Rhodes, gave a TED Talk about it. This was also on NPR and put out in RBA News, which is a local Richmond magazine. So here are some current projects. This is one that we're still working on. And this is a model for a tendon repair. This is still in the really early stages. Kind of get an idea. Actually, I just took these yesterday because I'm still figuring this one out. We're still like trying to figure out the funding and how to develop this. This is a project that's is in the research stage, which is really exciting. So this is a project that's done with the occupational therapy department here at the University of Florida, done with my collaborator, Mike Cricchio, who is a researcher, educator, and occupational therapist at UF. And this model is called the Dell hand. And as you can see here, it's plastic. It looks like glass, but it's like super clear plastic. And inside of it is a skeleton, obviously. And the Dell hand provides a kinesthetic learning experience for the permanent understanding of intrinsic and extrinsic hand anatomy. Students use the model to repeatedly draw using dry erase markers, normal or pathological anatomy of the hand. The project, as I said, is done in collaboration with Mike Cricchio. So this is how the hand is packaged. Right now, we are in the process of marketing it as well as conducting a research study. So you can see here, here's the hand and the dry erase markers. And this is it in action. You can see here the students are drawing, I think they're drawing in this the extender tendon and some muscles on top of it. So it's really, it's giving students a kinesthetic learning activity, so that they're not just learning on like a 2D book, but they're actually applying their anatomy knowledge on a three-dimensional form. So the study that we're working on right now is done with me, Mike, and Christine Myers, who is the director of the OT department at UF. And the title of the study is The Student's Perception of Participation and Knowledge of Hand Anatomy Following a Novel Educational Intervention. The aims of the study are to investigate students' perception of participation in the learning activity using the Dell hand, and to evaluate their knowledge of hand anatomy after their participation. It's an exploratory research design with survey, focus group, and a knowledge checklist that will be used to gather data on students' experiences in learning. So right now we have held a few workshops, and we're in the process of consolidating all of the transcripts, like really looking through all of the data that we've collected and consolidating all that feedback and trying to make sense of it. And then eventually we will publish it, hopefully in the Journal of Hand Therapy. Okay, so now we're gonna make a big leap outside of medicine. So this is a project that I just, well, it's not like finished, but the initial part of it I completed like 2 months ago. And this was in collaboration with a really exciting artist named Angela DeCarlis, who's a portrait painter. But what she's developed is this initiative called Figure on Diversity, which helps to promote diversity within figure modeling. Has anybody ever taken a figure drawing class before? Okay, so Adriana has. So figure drawing has traditionally been like figure drawing has traditionally been like one of the most fundamental skills that an artist can develop. Drawing the human form, it's pretty classic. I mean, like Picasso did it. It's like learning how to draw the figure is really challenging and really like it's just a fabulous skill to have. So, but often students will not just draw from a live figure model, but they'll also draw from plaster portraits because it's stationary. You can still get a pretty good idea of how to draw a portrait. But the problem is that a lot of the portraits that you can find within like a portrait catalog online is still of these Greco-Roman busts. So this project was to develop a series of portraits that represent more diversity. So, okay, I just explained that. Okay, so a series, so what it ended up being was a series of 3 portrait sculptures representing Black and POC individuals, a visibly disabled woman, and gender expansive models, sculpted and then eventually cast in plaster. Because as you can see here, these are cast in plaster, so we still want it to be like be somewhat within that tradition. The sculptures were drawn by students in the spring of 2022 Figure Drawing 1 course at the University of Florida College of the Arts. So the whole point of it was to sculpt these portraits and then actually have the students draw them within class. And you can see here that they're doing it. And actually, this workshop happened like the day after I cast these portraits. It was really quick. I mean, the sculpting took a long time, but once we had them cast, we just implemented right away. So these are the final portraits. This is a woman. Her name is Margot, and as you can see here, she's blind. This is the final piece. First, initially sculpted out of clay. Hours in the studio sculpting her. She actually came into my studio with her and her seeing eye dog, and she just sat for hours. And I just used traditional sculpting techniques of using my observational skills, sculpting tools, no 3D scanning or a life casting, just sculpting. And this is a man named Eugene, and he's from Ghana. Really, he's an awesome ceramic artist. That's his portrait. This is like a 3/4 view. And this is Yacoe, and she's from China. Okay, so I'm going to talk a little bit about the research study. So just like with the Dell hand, we created this hand, and now we're conducting research to really investigate the effectiveness of it. I'm doing the same thing for this one. Just so you all know that for these research projects, they've all received IRB approval. And just so that, in case some of you don't know, IRB is the institutional review board, which kind of gives the okay that it's okay to conduct research, to survey human subjects. So the aims of this study are to investigate students' perception of participation in a learning activity in which students made charcoal drawings of these new plaster busts. Some of our research questions are, do students demonstrate increased ability to represent historically excluded identities after drawing these sculptures? And also, does drawing from figurative sculptures which represent historically excluded identities deepen students' perceptions of bodies? You can see here some more of the students in action. This is really beautiful drawing. And I was so impressed. They just did these drawings in just one class period. So, yeah. And before we end this, I have a short video of the process of me sculpting these portraits, which I'm going to find it. Okay. Okay, let me screen share, stop sharing. Okay, screen share, here we go. Okay, so you all see it up here and the crowd sees it over here. So this is the mold making process. So the first step is to obviously like smooth out the sculpture. And then to make the mold, the first step is to apply a thick layer of rubber around the sculpture. It'll make sense in a minute. So after applying layers and layers of rubber, I build up a coat that's about like an inch thick. And then after that, a plaster mother mold is built on top of that, which you see down here, which gives the mold support. So it's like a flexible rubber interior and then a rigid plaster, what's called a mother mold, gives the mold support. And then it's bolted together using carriage bolts. So now this is me actually mixing the plaster to create the final plaster cast. That's me and my assistant, Sam Mendez. Sam's shaking it in order to get out any air bubbles in the plaster. So this is the moment of truth. After it's been cast, plaster has been poured into the mold. Now it's time to demold. So you can see that there's like some cleanup that needs to happen, and that's called chasing. It's just a part of the process. And this is a video of the students actually drawing them. And that's it. Thank you. Any questions? Sure. Let me just put this slide up here. Yes?
Yeah, I have two questions.
Okay.
How many hours or days does that mold take to harden? And
Which the
the ones you just did, when you pour in the
the plaster?
yes, how long does it stay like that?
The plaster actually doesn't take long to harden at all. Probably I could, once I've poured the plaster into the mold, could probably get away with demolding, like taking the plaster out like 5 hours afterwards.
Oh.
But it kind of depends. Like if it's an object that's like pretty sturdy and not a lot of like appendages, then it's pretty much like take it out 5 hours. But if it's like a hand, you really want to let it like set and really harden. So it all depends on the form, but never longer than like 12 hours.
How long did it take you to do those models?
To sculpt them?
Yes.
Oh, too long. Too long. I think I probably like 40 hours each sculpture. I mean, a lot of this project was a huge learning piece for me because portrait sculpting is something that people spend like a lifetime perfecting. And I had really taken on a project that was really challenging. So it was a lot of learning. So
Wow.
hopefully now it won't take me as long, but it probably will. I mean, it's just hard. It's a really challenging thing.
You've done a remarkable job.
Thank you.
They were just wonderful. Thank you.
Thank you.
Morgan, do you know how to check Zoom to see if there's any chat?
Sure.
or
Oh,
anything?
yes. Oh, that's very sweet. Thank you.
Right, we have a question here.
Again,
Yes, hello.
I want to echo Simon's comments. Just amazing, especially dealing with the braided hair. I don't know how you did that. But anyway, how do plastic surgeons or cosmetic surgeons tap into the resources that you could provide in giving a client who's going to have plastic surgery done an idea of what they would look like with the plan?
I think that I feel like to help visualize what a patient will look like, I think that they might have at this point like computer software that takes like a scan of them and shows what they will look like. But yeah, I do think that there is definitely a way to take that a step further and to actually create like a 3-dimensional representation of that that's not just on a computer model. Yeah, that could be an interesting avenue.
Are there more artists like you working with surgeons? This is amazing.
Thank you. I wouldn't necessarily say, I think that coming at it as an artist that's working with surgeons is pretty unique. I know that there are like engineers that are making, or designers that work in the similar fashion, but it's not really at the level of realism and sculptural expertise that can come from a collaboration with a sculptor.
Any other questions? Morgan, you want to check Zoom again and see if there are any other hands or questions there?
Nope, no questions.
Well, quite an amazing presentation.
Thank
Adriana, do
you.
you want to make any final comments?
I guess I had a question.
Sure, sure.
I guess, do you have any plans on expanding that busted project?
Yes,
Because I
yes.
feel like there's so much more that can be done there. It's amazing. Sorry.
Yeah, definitely. I think that publishing our project will be really great in terms of like validating the data, and also me and my partners, Angela DeCarlis and Julia Morrisroe, who's a professor at UF. We are actively trying to figure out how to acquire more funding for it to then create more portraits, and also figuring out if we could have this series installed within a museum, or to really get. But really, the main goal is to market these, is to have them in multiple classrooms across the country. So to really create a business plan for it, to really market and get these out there.
That's so cool. I have a follow-up question
Yeah, go
to
for it.
that, because that made me think. So I know you were talking about how you had to do the IRB approval
Yes, yeah.
for that. So like if you're trying to like market it further, like how does that work? Like do you have to circle back to these people that you've sculpted and then kind of get their consent at each stage of like,
Well,
I don't know, like using their likeness?
That's a good question. The IRB doesn't really have to do with the models. The IRB just has to do with surveying students who have participated in, who have drawn the sculptures. But the models, that's a great question. We, within our business plan, we are thinking about that, and will, if all goes as planned, the models would get like a small percentage, like a royalty expense, like a small percentage of each sculpture.
Wow.
Hopefully, that's our plan.
Okay, awesome.
Yeah.
That's amazing. Thank you so much for being
Of
here.
course.
This
Thanks
has
for having
been-
me.
Yeah, I've learned a lot today. I think we all have. But are there any other questions? Oh,
Just a comment that if you ever decided to go into private practice and doing sculptural portraits, I think you'd do very well.
Thank you.
I think a lot of people, especially wealthy people, would pay a lot of money to have a three-dimensional sculpture of themselves as compared to just a two-dimensional portrait. So I think you've got a good future ahead of you.
Thank you.
Right.
All right. Well, thank you so much for joining us today. Thank you, everyone.
Thank you. Thank you very much.
All right. Take care.